Good morning, everyone. First, thank you so much, host, for the beautiful introduction. And I truly appreciate the invitation to be here with you all today. I'm truly honored. And as I just mentioned previously, like I'll be discussing about my reflections as someone who's interested in microsurgery as a resident. And also I'll be discussing about my experience so far in publishing scientific research as a resident and the lessons that I've learned, the challenges, how did I come those challenges, as well as if any future directions that I'll be mentioning. And also, like I'll be talking about briefly about our training program here in Saudi Arabia for residents, as I was instructed by the committee. Again, thank you so much, the Korean College of Surgeons, for the invitation. I'm truly honored to be here. I remember that when I met Dr. Soko, I think he's the founder for the Ukraine College of Surgeons. Correct me if I'm wrong. And he actually invited me to give this talk back when I was with him in Taiwan. And I was truly honored and I was very excited to actually give this talk as a new opportunity and a new topic that I have not presented previously. What I'll be talking about today, I'll be briefly introducing about the Saudi Board of Plastic Surgery, just like briefly about our program, the structure, the requirements, and the challenges as for the residents, and just as an overview. Also, I'll be discussing about someone who's interested in microsurgery per se, um, um, what are the things and the values and the reflections that in my mind that would like to have and focus on, and as someone like would like to pursue a career in micro surgery. And then I'll be discussing also about my experience so far in publishing scientific research, and why actually research matters, and what are the opportunities and barriers, and how someone can actually benefit from publishing papers. And I'll be sharing my own experience in scientific publications as overall. And as I just previously mentioned, that by the end of this session or presentation, we'll be having a short Q&A to answer all the questions or the comments, or if anybody have like an idea to discuss. So by the end of the session, we'll be having the Q&A. So just briefly about me. As the host actually introduced me, my name is Hatam Murtala. I'm a plastic surgery resident currently in my 5th year. By next month, I'll be in my 6th year. So my last year in residency training in Riyadh, Saudi Arabia, which is the capital of Saudi Arabia. And I'm truly passionate about scientific research, especially definitely in publications in plastic surgery. I've actually founded also a plastic surgery interest club. It's like the first interest club in plastic surgery in Saudi Arabia. It gathers all the medical students and the residents who are interested in plastic surgery to actually develop a community, so those community can actually grow as well as publish together, and each will be benefit the other. Also, I have actually founded a researchable platform. It's a platform that provides research courses, books, as well as research services, in addition to publishing to more than 140 publications, and I have a couple of thousands of ResearchGate reads and citations on Google Scholar, as well as a ResearchGate. Without further ado, this is like my ResearchGate. If anybody have an account of ResearchGate, you can follow me there and keep up with my latest publications in plastic surgery. I'm also a peer reviewer in different journals, like for example, the European Journal of Plastic Surgery. I'm a reviewer and ambassador in the PRS and the PRS Global Open, as well as an editorial member in the Archives of Plastic Surgery. I definitely recommend anybody who's interested in research to sign up as reviewers in different journals. It's an extremely useful experience, and it will definitely enhance your overall background as well as your research experience when you're reviewing and judging others' research papers. So let's start with briefly about the Saudi Board of Plastic Surgery and what is it exactly. So the Saudi Board of Plastic Surgery, it's actually a 6 years program. It's under the supervision of the Saudi Commission of Health Specialties, from the first to the 6th year. Usually we join it after internship. So we have 6 years medical school. After that 6 year medical school, we join an internship year. During that internship year, we rotate to different specialties, including obstetric gynecology, general surgery, also like, for example, internal medicine, etc. And after you finish that internship, you apply for residency. When it comes to plastic surgery, it's considered as the most competitive specialty across all specialties in Saudi Arabia, and it is like almost a 6 years program. The program we distribute into different hospitals in Saudi Arabia, the major centers, major tertiary centers, and these centers we get exposed to different cases and different subspecialties in plastic surgery, whether it's an aesthetic, hand, micro, craniofacial, or even burn surgery. The first 2 years in plastic surgery program in Saudi Arabia, I don't know if it's the same in Ukraine. We rotate to different surgical specialties, including general surgery, orthopedics, ENT, dermatology, ICU, and a couple of plastic surgery rotations. And from the BGY 3 to BGY 6, we are focused and dedicated to only plastic surgery. The third and the fourth year, you're considered as a junior plastic surgery resident, and the fifth and the sixth year, you're considered as a senior plastic surgery resident. One of the requirements to actually finish the board of plastic surgery, you have to publish research papers, as well as we have exams. For each year, we have one exam to get promoted from one year to another. And this promotion exam is usually based on the fundamentals of plastic surgery and overall aspects of plastic surgery. And then for the final year, which is the sixth year, you have the board exam. The board exam is also, you have two different exams. The first exam is like you're having an MCQ-based exam, and the second is more of an oral and discussion exam. So when it comes to acceptance to the Saudi Board of Plastic Surgery, there are different eligibility criteria, including having an MBBS degree, completion of 1 year internship, and then there are different assessment scores, including the GPA. We also have something called the Saudi Medical License Exam. It's similar to the United States Medical Licensing Exam, but for this specific exam, you have to get a extremely high mark to get nominated to plastic surgery. And once you get nominated to plastic surgery, you will have the opportunity to get into the interviews. And how you do in the interview is it will be the final assessment for getting acceptance. There are very minimal seats in plastic surgery, so almost like every year there are more than 5,000 graduates from medical school, and only those almost like only 20 to 25 seats are available for plastic surgery. So like this is the map of Saudi Arabia, and the residency training program is only present in 3 different regions, which is the central region, which is Riyadh, where I'm currently doing my training in, which is the capital of Saudi Arabia. And then we have the western region, which is Jeddah, and then the eastern region, which is Al-Ahsa. So when it comes to plastic surgery, as you all know, we have different subspecialties in plastic surgery, whether it's an aesthetic surgery that includes rhinoplasties, abdominoplasties, facelifts, etc., burn surgeries, as well as craniofacial, hand surgery, and microsurgery. Personally, throughout my residency, I felt like microsurgery is the most suitable fellowship I would like to pursue my career in. So as you know, after you finish your training in residency, you have to choose a subspecialty, or you don't have to, but preferably you have to you preferably choose a specialty that you would like to pursue a fellowship and dedicate your career in after your training, whether it's micro, hand, craniofacial, etc. So I decided to actually, I would like to pursue a fellowship in micro surgery. So since early on during my training, I was truly fascinated how microsurgery is very delicate, as well as the complexity of the procedures and the fact that you're transferring like a soft tissue from one place to another. It's extremely, I was very extremely actually fascinated by the scope of of the microsurgery itself and its complexity, as well as its need especially in Saudi Arabia, with a lack of a lot of micro surgeons. So I was actually trying my very best to enhance my exposure to microsurgery itself. As you know, microsurgery, it's not only about head and neck. There's other aspects in microsurgery training, including trauma reconstruction, like for example, reimplantations. If someone lost his digit, reimplantation back by a microsurgery, or for those patients who have persistent swelling in the lower extremity, those diagnosed with lymphedema. You can do LVAs or NVAs, or especially those patients who have breast mastectomies, and then you can proceed with a DIAP or deep inferior epigastric artery perforated flaps for as a free flap for reconstructing the breast. However, having actually mastering microsurgery, it definitely needs and precision, needs dexterity as well as a sharp decision making. Unfortunately, like here currently in Saudi Arabia, we don't have a lot of microsurgery exposure, and we're limited in the hands-on exposure. Definitely, it's due to it needs a steep learning curve and the possibility of increasing OR time. Actually, I did this survey among my colleagues in Saudi Arabia about how's their exposure to microsurgery. I distributed the questionnaire to almost 32 individuals, and the main question was asked if my colleagues were actually having enough exposure for microsurgery, including the hands-on experience, and only about 12.5% that reported with a sufficient exposure, and the rest actually mentioned that there is a scarcity of structured microsurgery rotations. So therefore, I was trying my very best to know what are the different aspects I can do and enhance to become a microsurgeon and to actually know more about the microsurgery scope during my current training and how I can prepare myself to become a microsurgeon after I finish my residency training, especially with the lack of exposure of microsurgery at home. So actually, I looked for different simulation-based practices, including like for example, using like for example cadaveric dissections or more of suturing anastomosing, like uh, like doing it in the labs, or even using those rats-related models for anastomosis. I found actually this is very useful this is a very useful tool called the Microsurgery Trainer Kit. It provides like a synthetic microvessels that you can use your phone for sanding and putting your phone, and you're using it as a microscope so you can do the anastomosis and having a very structured simulation program and such training tool that you have available with you 24/7, and you can practice microsurgery. And these actually can also have such bio-like tissue synthetic microvessels. It's almost like the real vessel, but it's definitely more tougher and harder. But however, it actually can provide a realistic exposure and experience compared to in reality. And actually, this is my my simple yet effective setup I have at home. So I just practice microsurgery anastomosis whenever I feel like I'm having a microsurgery case to prepare for. This is just like an iPhone, and then I have this micro set that I just have available at home, and then I just put a couple of stitches and keep improving my overall experience as well as surgical skills in microsurgery. And the nice thing about this actually pack is that you can record while you're doing the anastomosis, and you can actually provide an valuable assessment tool for yourself for recording the procedure itself or the anastomosis, and you can actually calculate how many minutes did you spend for this anastomosis, and you can compare yourself every now and then, and for self-assessment as well as feedback from any mentors. And this is just like one of my first anastomosis that I've done through this pocket microsurgery pack. It's extremely nice. I can just like try my very best to critique myself, identify what did I do wrong. Did I leave like a large space between the stitches? Did I take the back wall? Or even like if if I cut it, the stitches like too short, etc. So I just try to improve myself every now and then. And the other aspect is that based on other than the simulation-based practices is that workshops and microsurgery courses. As you know, there are a lot of microsurgery courses around the world. Those microsurgery courses actually is extremely beneficial. And personally, I think like they're essential for anyone who's interested in microsurgery or interested in a career in microsurgery. These courses actually provides a hands-on workshop that bridge the gap to the clinical practice later on when you actually work on a real case in a real patient. These courses actually can provide you with a supervised practice and exposure to diverse techniques, especially if a mentor or someone who's more experienced than you can teach you and guide you throughout the light. And it provides excellent networking and opportunities and definitely international collaborations later on if you actually met a couple of individuals or other members during the workshop. So this workshop that I've done back in 2000, I think 22. It was called the Advanced Microsurgery Skills Training Program. It was in Columbia University. It's in New York, USA. It was led by Dr. Yelena Akalina. I attended this 5 days workshop course. It was extremely useful and transformative experience for me. Since then, I felt like my microsurgery skills that actually dramatically enhanced after having such a workshop. It provided me with a structured hands-on practice using those living models, which were actually the rats. This is actually one of my anastomosis I've done in the workshop. It was like an end to side. It was very nice, and I really loved it so much. I would definitely encourage anybody who's interested in micro to do these workshops. Not per se this specific course. There are a lot of other courses that provides like such micro experience. And if anybody who's interested, I will be showing you in the following slides. Also, like other than the micro courses, there are those cadaveric courses. This is like one of the cadaveric courses I have attended as a pre-congress course. It was before the WSRM, the World Society of Reconstructive Microsurgery conference back in April. Yeah, it was in April in Barcelona. It was very nice, and I met a lot of amazing people, individuals, and this is me was just like having the best time of my life, dissecting and enjoying micro. So those who was interested to know actually about these courses and like how can I know about the workshops, this is a very beautiful written paper that was published in the PRS Global Open about how to develop your microsurgery skills outside the operating room. It was published in 2024 in December. It's very nice. I honestly highly recommend anybody interested in micro just to go through it and give it a read. You can just scan the QR code here and it will give you the access to the full text of the manuscript. So this paper is actually listing all the micro courses in different countries, including the United States, and the general description about this course, as well as what the models that are being used in these courses. So moving on, after like joining those workshops, actually one of the most critical steps or the most critical aspects of doing a career in microsurgery is finding appropriate microsurgery mentor. Those mentors actually can very helpful to guide you and they will guide you throughout your career as well as provides the best opportunities and connections that will definitely help you in your fellowships or your career in microsurgery or even later on during cases if you'd like to have another opinion. So definitely I highly recommend anybody who's like looking for mentors in microsurgery, you can seek those whether it's in your own institute, if you had microsurgeons in your same institute, or just go abroad, like to different institutes that very famous in microsurgery, as I did. So this is a photo of me with Professor Raja Sababathi. He's a pioneer in hand and trauma as well as congenital pediatric hand. He's a pioneer microsurgeon. This was in Ganga Hospital in Computer back in 2023. I visited that hospital for 2 weeks. It was a truly amazing experience. I've seen a lot of cases of microsurgery, and it enhanced my scope as well as overall experience in microsurgery. And this was also Professor Harry Venkatramani. He's also a professor of microsurgeon at the Ganga Hospital. He's doing a lot of complex surgeries, including trauma, breast recon, lymphedema, and all other aspects in microsurgery. Uh, Fun fact that I actually, after I finished my visit in Ganga Hospital, I decided to write my experience as an experience for visiting that hospital, and what are the things that I've learned during my visit to Ganga Hospital. You can also scan the QR code if you're interested in reading my paper about my own reflections on the Ganga Hospital visit. And the year after, in 2020, 2024, yeah, I decided to visit one of the most brilliant microsurgeons in the world, and he's a pioneer definitely in lymphedema and lower extremity reconstruction, Professor GP Hang. He's also a professor in Astan's Medical Center in Seoul, South Korea. This visit it was definitely was a transformative experience in my microsurgery journal, and the fact that I've seen a lot of skip flaps with Professor JP. It was also I scrubbed with him in multiple cases. I did anastomosis with him. It was extremely nice and very amazing experience for me for someone who's interested in micro surgery. I also I also published my experience as a paper in Archives of Plastic Surgery. This is me with Professor JP, and this is the paper I published in Archives of Plastic Surgery about my reflections on the ASAN plastic surgery visit. It was a very nice experience. Also, like if you're interested to read this paper, you can scan the QR code and you can check the full paper. Um, So, what are the challenges in the OR, in the plastics in the microsurgery itself? Definitely, there are limited access to microsurgery cases for the residents, especially if the resident is a junior level or is inexperienced in microsurgery. This will decrease your opportunity for having a microsurgery hands-on. And so how can you overcome these issues? I actually thought about having these kind of strategies that you can keep in mind for having a more microsurgery exposure from only assisting to performing the supervised microanastomosis. The first thing, and for every case, you definitely have to prepare for the case that you'll be joining.
I'm sorry, Dr. Mutada, we cannot hear you. Something wrong. Try on and off your mic.
Yeah, what about now?
Oh, okay, okay. Just now we can hear you.
Okay,
Right, you can move on.
sure. Can you hear me now? It's
Yes,
better,
yes,
right?
great, yes,
Great, great,
yes.
great. Yeah, so I was just like discussing about the different strategies for having proactive engagement in microsurgery cases. As like, for example, case preparation, you have to read the anatomy, know about the patient, and overall the indications, as well as the operative step. In addition to building a trust with your mentor or the consultant that you're working on, and always be present and volunteer for every opportunity in microsurgery, even it's just like simply closing the donor site. It's still an opportunity in microsurgery. This is actually me took a picture of myself like a selfie. I remember like this one of the cases that I've had like during my own call with one of my attendings. We tried our real
I'm sorry, Dr. Matada. We again don't hear you. Try again on and off mic.
yeah. I'm sorry about that. So yeah,
Yes.
yeah. So basically, like in this slide I'm showing, this is a selfie of myself. Like I took a picture of me working on under the microscope. This patient actually he presented with almost five digits amputations. I remember like Omar, the attending that I was working with, he was very hesitant whether to take him back to OR for reimplants since the mechanism of injury was crushed and it was extremely devitalized as well as not compatible for reimplantation. So I was very actually trying my very best to convince my mentor and the consultant that let's take him for reimplant, and then he accepted to go for a reimplant and give it a try. And this is just me preparing the amputated fingers before bringing the patient to OR. So the highlight of this picture is trying your very best to be as proactive as possible, volunteer in cases, and show that you're interested and readiness in every opportunity to build on and hands-on experience. And last May, I was actually I had the pleasure to visit Professor Fushin Wei in Taiwan in Shangang Memorial Hospital. I visited the unit also for 2 weeks. Just as a side note, these visits were not sponsored by my institute, nor it was sponsored by my residency. It was all based on my personal arrangements as well as my personal expenses. So I went for Taiwan at Shanghai Memorial Hospital. I spent there for 2 weeks. It was a very nice experience. It was the best place for head and neck reconstruction and facial reanimation. I saw a lot of cases and I had a wonderful time in meeting beautiful individuals as well as people. This is with Professor Johnny after we are done with facial reanimation case during one of the Freegacillus flaps for a second stage facial reanimation. And also, like I wrote my experience as a paper, but since I just recently came back, like almost 2 months ago, the paper is still under review by one of the journals I submitted to. So this is my experience, my reflections on microsurgery and how can someone is interested in microsurgery can pursue a career in such fellowship or such aspect in plastic surgery. I'll be moving on research and why research is actually important for individuals who's interested in plastic surgery or even like overall physician. So basically, like research is extremely important because it opens doors. A lot of doors can open for you by publishing manuscripts and building connections. Whether you're a medical student trying to apply for a residency training, or even if you're a resident trying to apply for a fellowship, those publications will definitely boost your CV and will give you the opportunity to build these connections so you can pursue your career in the aspects you're interested in. Also, in addition to that, it builds your network and influence in the specialty that you're interested in. And it's definitely more than a line in your CV. Research will definitely sharpens your critical thinking, deepens your clinical knowledge, and builds your academic credibility. So I'll be discussing about how did I start my research journey. So actually, I started working in research since almost like 2016. I was just like a third year medical student. I didn't know I wanted to do a plastic surgery. Um, so me and my friends, like in mid school, we decided to do a research project. We thought about what's the simplest way we can do a research, since all of us were not experienced enough in doing such project. So we decided to start with a cross-sectional study. Cross-sectional studies is based on a survey. We actually did a cross-sectional study by doing a survey that we distributed among high school individuals about like a specific topic about outside plastic surgery. It's about like video games and nocturnal enuresis. So basically, we took those surveys, we distributed among different medical students, and this is us, like me and my research groups, actually having my different meetings, as well as this is me back in 2016 after I gathered a lot of data and we finished the data collection. I was extremely happy back then, and also had the opportunity to present that paper like in a couple of conferences. And this research paper, it took me almost 2 years to publish, even though it was like just a cross-sectional study. But the fact that actually it was my first paper, I had like not the experience that I actually have today in publishing manuscripts, and we published it in, I think it was like a Q3 journal, in a scientific publication, in a scientific journal. And this was the study that it was like my first publication in research, academic research. So what did my first research publication have taught me? The first thing is that you don't need a perfect tool to start. All right. So just like think what is around you and what's like within your hands, that you can make the most out of it, so you can come up with a research idea or conduct a research. In addition, that it taught me about the collaboration with my peers as well as my colleagues, and it actually matters more than knowing everything, because these collaborations will can be built up for ever. In addition, that this actually paper, as I previously mentioned, it took me almost 2 years to publish. And the fact that it took me 2 years, we actually had a lot of rejections. And rejections, definitely, it's not the end. There's always a place for your paper that can be published in a journal. Our paper was rejected a couple of times until it got accepted. Seeing your name in a journal, especially as the first author, is truly a transformative moment. This was my first publication as well as my first author publication. It was a very transformative moment, and I had a blast, and I was extremely honored to do that paper. And honestly, I'm proud of it, and I'm proud of the outcomes we came up with. And then like 1 year after, I decided to do my first. I was then started to become interested in plastic surgery, and I found the field that I would like to pursue my career in, which is plastics. So this was me. I think I was like fifth year medical student with my mentor. His name was Dr. Hatan Al-Joali. He was a plastic. He's a plastic surgery consultant. I met Dr. Hatan Al-Joali, and I'm informing you that I'm truly interested in plastic surgery. I would like to do a research with you. And we actually did the research. I did the research with him. And also, like, I was the first author for this paper. We published it in back in 2019. It's mainly about the perception of plastic surgery and the role of media among medical students. So we distributed a questionnaire among the medical students in my university, and we assessed their awareness. Are they aware of plastic surgery or not? And actually, unfortunately, the majority of the medical students had poor awareness of plastic surgery. And if those who's interested in reading this paper, you can find it on PubMed, as well as the journal, GMR journal. And couple of in the same year, actually, I published other papers. Were like 5 different papers I published. I think three of them were on plastic surgery, and the others were not related to plastics. It was like more of dermatology. Like for example, this paper. And then I had the opportunity to take all of these papers and present them in different conferences. So whenever I saw like any opportunity to present my paper, any abstract submission announcements, I just submit my papers and try my very best to increase my presence in plastic surgery conferences, as well as in those conferences to present my papers and my work. This is like one of the conferences that I actually presented. And there was a research competition, and I was truly humbled that I won the first place as the best research oral presentation. And this is with my mentor, Dr. Hatan Joali. We also presented with my one of my papers with him in the ICOPLAS conference. It was back in Dubai, 2000, I think, 21. And this is like one of also the presentations that I presented in the Bern Gulf region. This is all other presentations. So when it comes to actually presenting at conferences, actually it's really a game changer, and I highly recommend anybody who have the opportunity to present, whether in a conference or like for example this journal club. Um, I truly believe like it actually can change you a lot, and it can definitely enhance you and make you a better person as well as a better speaker, and it will give you a credibility that will help you a lot in your career. Moving on, like one of the main turning points in my research career is publishing my first systematic review. Publishing my first systematic review was in 2021. Uh, as systematic reviews are considered as one of different study designs for research papers. For those who doesn't know what systematic review, so basically systematic reviews are gathering different papers from the different databases that having the similar research question, so you can come up with a big paper based on these different data that has been previously published. So when I published my first systematic review book back in 2021, it was just like two authors, me and my colleague. We were interested in like body contouring and its complications. We decided to do a systematic review meta-analysis, and actually we published our paper in a Q2 journals, which is also like with a impact factor almost with a 2.5. It was the aesthetic plastic surgery. And since then, it was a very turning point in my career as well as research focus. I thought that systematic reviews are actually extremely nice to conduct. It's very useful, and it has very high acceptance rate by the journals. So, what are the lessons that I learned from my publishing my first systematic review? It was surprisingly fun to do. Systematic reviews were extremely fun. It was very nice to conduct, and I thought that it's rewarding to actually to publish such papers. In addition, that in those papers we did not need like a consultant or attending to be involved. We don't need an IRB approval. We only need access to the database to gather the data and write our manuscript. In addition to that, it has a very clear structure to actually to do in a systematic review. You start by protocol, then searching the articles, screening, then analyzing and writing the manuscript. In addition to that, its systematic reviews are very highly publishable even without original data. And the fact that you don't need an ethical approval, like for example, retrospective studies or prospective studies, is a positive criteria or point in conducting systematic reviews. And this paper is actually now is almost cited more than 50 times. And this is a proof for me personally that well done reviews will definitely have a real academic impact. And since then, I've been working on a lot of systematic reviews. I think I've published like more than 50 papers as systematic reviews. I have gained a lot of experience in systematic reviews and how to do them. And since then, I decided to do, why shouldn't I just do a workshop about conducting systematic reviews? I would like to share my knowledge on conducting these kind of research papers. So I decided to do actually to do a workshop, just like a workshop for doing systematic reviews from A to Z, sharing my own experience on how to do how to do these papers. Because all the experience that I gained to conduct these systematic reviews, it was just like based on my personal on and off experience through submitting the papers and getting feedback from the journals. So we did this workshop that actually I posted about for those who's interested in learning systematic meta-analysis. I'll be presenting about a systematic review on how to conduct a systematic review. I posted this post on Twitter, I think back in 2023. And then I realized that there's a lot of medical students and interns as well as residents who are extremely fascinated, and as well as where they're willing to learn about systematic reviews. And it made me realize how there's a gap, and there's a tremendous gap in the teaching systematic reviews. So I decided to start live online workshops on detailed steps for conducting systematic reviews, in addition to real examples on how to do these review articles. And from this workshop, I decided to actually create my own platform for conducting systematic reviews. It's called Researchable. I officially launched the Researchable platform back in May 2023, and this was our Twitter account on Researchable. I decided to do live sessions about systematic reviews. Also, like we published our book for conducting systematic reviews, and we decided to also do an academies, a Researchable academies and summer schools for conducting research papers. I tried my very best to make this platform. It's focused more on hands-on and outcome-driven research. It's not about just theory or knowledge overall. No, it's an hands-on and how to actually come up with a publishable systematic review. It's being delivered in Arabic and English for a wider audience, and it's built mainly for medical students and interns and residents per se for a clear understanding of their challenges. This is the platform. So basically, like the platform now, more than 6,000 individuals that actually they use the platform. We did a lot of researchable academies, as well as we have a lot of publications throughout. Those who joined our academies, they published their manuscripts. We have more than 80 manuscripts that has been published throughout after my courses on Researchable. Uh, for um, for those who's interested to actually read those publications, you can find them on researchable-sa.com, or you can like scan the QR code. And the fun fact that is actually those who actually also like joined our courses, they had the opportunity to present their papers in scientific meetings and win prizes, as well as during their competitions in different conferences and lectures. So these are like the conferences that they have participated in, as well as winning their awards. And throughout this platform, I also published like multiple books. Like this book was about a step-by-step guide for conducting systematic reviews. Also, we did a book for narrative reviews and case reports, as well as cross-sectional studies. So Researchable actually did not start as a business. It started as a solution. I knew the pain of actually starting alone, especially in systematic reviews, and I wanted to remove that by and remove that barrier for others. That's why we did the Researchable platform. When it comes to actually challenges for research, especially in residency, as someone who have published more than 140 publications, there are a couple of myths that I hear a lot about. Like a lot of my colleagues, they come to me like, "Why are you publishing so much? How do you have the time, etc." So basically, like the main myth is that I don't have time. When it comes to research, you don't need a lot of hours every day. You need just to be consistent, at least like 30 minutes or like 1 hour per week, just dedicated for research. And usually, what I do is I started working on research like during the weekends, or even like for example after, or like for example like between cases, etc. It's all about that 1 hour you can get the most out of your research, in addition to having a colleagues, as well as a group of individuals that is aiming to publish a manuscript with you. This will definitely help you a lot in coming up with a research paper that is publishable. So how can I start? How can I start a research paper like as an overall? Uh, the first step is definitely you have to start. You don't need to start big, start small. Choose a manageable study data or study type or methodology, whether it's a case report, especially those who are residents. I think case reports are extremely beneficial because you have access to patients. You're seeing a lot of patients during your work. So definitely at least like once a month or twice a month, you will find a case that is publishable as a case report. Also, like retrospective chart reviews are extremely valuable, and in addition to the systematic reviews or narrative reviews. So once you started with the appropriate study design, you can proceed with the rest of the steps, whether it's finding a mentor or accountable partner or a group of individuals who are willing to actually also work on the research itself. And then you can build a simple research habit by actually doing the research work, whether it's step by step until it's being published and distributing the work equally between you and your research mates. There are different tools that have actually boosted my research productivity. Like for example, I use TickTick for to-do list, and Ryan is extremely beneficial website like for conducting systematic reviews. Google Scholar is my number one friend when it comes to research, and Google Drive as an overall arrangements as well as distributing the tasks between me and my colleagues. So this is just a research roadmap for your next steps for conducting research. So the first step, definitely you'll have to find a study type and study methodology that you'll be wanting to conduct, and then the topic that you'll be, or the research question that you'll be would like to answer. Then find 1 to 2 co-authors or individuals that you'll be working with, and then divide the tasks between you and the co-author and the other co-authors. Like for example, you are the main author that will be responsible for the proposal, and then like for your colleague, your partner will be responsible for like the writing the introduction, and the other will be like responsible for example, like creating the questionnaire, etc. Having a draft timeline is extremely important. Keep in mind deadlines as well as try to encourage your team as much as possible. So when it comes to my final message for today's session, um, start with a one small study. You don't need to actually have a very difficult topic or RCT or any complex research related ideas. Try to start as simple as possible. And the goal is momentum, is not perfection. The second message is that learn by doing. You don't need anything before you start. Most of what I learned is actually came after I began. So basically, try to learn what you're about to do. Like for example, the next step is about writing research proposal. So how can I write a research proposal? You can just like go to YouTube or like look it up online, how you can do a research proposal. Then after you wrote a research proposal, you have to, for example, do a questionnaire. How you can do a questionnaire also like by doing it. So learn by doing the steps that you'll be doing throughout your research. You can learn it step by step. And the last message is that use your residency training or years to build a legacy. These years definitely are demanding, but they're also full of clinical material access and opportunities. Make them count. Again, thank you so much all for your attention, and I hope you liked my session. I know like I talked about different topics and aspects, but I tried my very best to make the presentation, the session as inspiring as much as possible and very beneficial for you all. And it's all based on my experience. Thank you all so much for everyone. Now we'll be having
Uh,
Q&A. Anybody having like any questions or concerns, you can just like write it in the chat and I'll be answering
yes.
it.
Thank you, Dr. Murtada, for so interesting lecture. It's really golden knowledge, and
Thank
I
you.
think it's not always be very important in future for our participants. So while our participants thinking about question, what we wanna ask, I will ask first. So
Sure.
you told about training at home, micro training. So
Yeah.
um, do you use any unliving model like chicken wings or something? Because you show us artificial arteries. Uh,
Yes.
do you using any unliving model at home?
Yes, yes. Actually, previously I've used like chicken wings. It was extremely nice, especially like doing the nerves as well. It was very useful, but actually I found it a little bit messy to handle that. So I decided just to stick with the synthetic vessels. It was very nice and to be using as well as very simple, you know.
Yes. So you think artificial vessels can be solution and for don't using any living model or unliving model.
Yes, it's possible. You can actually use it both. It really depends on like what you're aiming for or like if you have like the space actually or not. But I found like the synthetic vessels can be very beneficial, an alternative for animal models or non-living models.
What about the models? It's very important to go through these steps for next to experiment to its searching on synthetic versus then even go in operation room or it's necessary step to go in the crowd lab and make some analysis with a riot or a different building model.
Yeah, correct.
This is necessary. Uh,
I'm sorry because like your voice is a bit lagging.
okay. Um, uh, second, is better.
Yeah, it's better now.
My question is, do you necessarily use a living model for
I'm
training
sorry.
to be able
It's a bit laggy. I don't know if it's from your side or my side, but your voice is a bit lagging. Would you like me to
now?
answer the questions in the chat meanwhile?
Sorry, Dr. Khatan, it's perhaps technical issues on the side
Yeah.
of Dr.
Okay, no
Anatoly
worries.
Vaturi. Perhaps Dr. Anatoly can write his question in
Sure,
the
sure.
chat, and at the same moment, all other participants would ask their questions or prepare. Yes, I at the moment have one question, if you don't mind.
Yeah, for sure.
I was on the road, so I could miss something, but your speech was very interesting and informing. And the topic about the research was most. But you mentioned a little bit about finding of programs and going abroad for training programs by your own.
Yes.
How you organize that process, and is it do you planning in the future to do that same? How often you are planning to do that? How you manage that? Because in Ukraine we also have a problem with a systematic visiting abroad some institutions. How you manage in your country? Do you have some programs in your country for plastic surgeons? Thank you.
Yeah, thank you so much for your question. So actually, all of these visits I've went to, like for example, India or Taiwan or even like Korea. It was all based on my like arrangements, and it has nothing to do with my program or my training. So it all came out of my own interest, and definitely all the funds was based on me. I did not receive any fundings to sponsor all these trips. So what I usually do is like I meet these individuals or the consultants, like for example, Professor JP Hong or Professor Raju Sababathi, through conferences or meetings or workshops. Then I just like introduce myself to them, and I ask them that if there's any possibility if I can visit them in their institute. So like for example, I remember like when I met Professor Fu Wei back in a couple of years. I asked him that if I can visit him in in Shanghai Memorial Hospital, and he was very welcoming. So he gave me like the email of his secretary, and I emailed the secretary, and she was also very welcoming. And I just decided like on the dates. When it comes to the dates or like the duration of my visit, so all these visits also is part. Sorry, all these visits is actually is part of my annual leave. So as residents, we have like almost 30 days, 30 days per year. And throughout this 30 days, it's like an annual vacation. So basically, like I take this opportunity to visit these institutes. And as you can see, like all these visits were not more than 2 weeks. All of them were 2 weeks exactly. I go there for like 2 weeks. I visit the institute. I try to make connections and learn new stuff, and then I just go back and try to write a paper about it. But as overall, it was all based on my expenses. It was based on my annual leave. It has definitely nothing to do with my program or my training, residency training program.
Great. Okay, thank you.
You're welcome. You're welcome.
Perhaps Dr. Anatoly reconnected with us.
Sure.
Looks like he still has a bad
I
connection.
can I can read the comments like in the chat, and I'll answer them.
Yeah, I can also ask a question from
Sure.
what I wrote down in the chat. So first of all, thank you very much for your presentation.
You're welcome.
Really great and also motivating for me. So my first question is, what are the qualities of a great mentor that we should orient on when we are looking for him or her? Thank you.
Yeah, thank you so much for the important question. So when it comes to the mentor, like when it means like a mentor, you have like two different aspects. Whether it's like a consultant or attending that will be supervising the research project, or a mentor who's like a more senior resident to you, who will be like guiding you through your paper. If you mean like a consultant or attending, I prefer to always choose like someone who's reachable and someone who's actually can answer your questions as well as can guide you throughout your steps. Most importantly, is someone who's reachable, who can reply back, as well as reliable. You don't want to work with someone that who's not reliable, or who will just ignore your emails or your text. So definitely just like look for someone who's eager to publish this manuscript with you.
Thank you very much. So basically, it shouldn't be a great professor of all times and so on. So it could
Yes,
be
exactly. Especially like
senior.
those great professors, because a lot of them they're very busy. They will not like respond to your emails, or like they will not be cooperative when reviewing the manuscript, etc. So you don't want to waste a lot of time. You want to get the work done and then publish your manuscripts as soon as possible. But if you have like another preference of actually having your name next to like a very famous consultant or a professor, that's also up to you.
Thank you very much.
Thank you.
Dear participants, perhaps someone also has their own question, so don't be shy and ask them in a chat or here. And we can read a few questions from the chat already. If they weren't read earlier. So what do you think, what's the qualities of a great mentor that we should orient on when we are looking for him or her?
Yeah, I think I just answered that one
Sorry,
with
sorry,
mentor.
I missed. Also, also question from Dr. Dmitro Dumchak. What about development autonomy? Yes, the same. And one more question, could I still do research being utterly scared of all the statistics stuff and being really bad at mathematics in school?
Yeah, so for the first question, the autonomy in the operation room, it really depends on also like the attending, but the majority, it depends on you too. As someone, like you have to know about the case, you have to be prepared, as well as showing interest, and having a small background in microsurgery. As you know, I'm still like a resident, and I don't feel like I've worked a lot of microsurgery cases with my attendings. As I mentioned in my presentation, we don't have like a lot of micro cases. That's why like I'm trying my very best to widen my exposure. But however, having the autonomy, it comes like step by step. First, like you can start by closing like, for example, donor side, then like assisting in under the microscope, and then like cutting the stitches. So I truly believe like it comes with step by step and building trust with your consultant. For the second question, so when it comes to research, yes, definitely, like knowing statistics is important, but it's not everything. You only need to know the basics of statistics. And there are different type of study designs. You don't need any statistics background. Like for example, case reports, you don't need any statistics background. Like for example, case series, you don't need any statistics background, or even narrative reviews or synthetic reviews. You don't even need you don't need a statistic background. When when it comes to statistics background, you need it like for example in cross-section studies, prospective cohort, RCTs. Your background is important, yes, but it's not everything about related to the paper. Sometimes you can overcome this issue with inviting your colleagues or other members who have a strong statistics background to handle the statistics part. Otherwise, you can do the rest of the project. So research is not all about statistics. Yes, it's part of it, but it's not everything.
Thank you very much for your
Thank you.
Thank you.
Also a question from Dr. Anatoly Vatulia. Oh, sorry.
Yeah, please go ahead.
He's asked a question about practical preparation. His question was whether it is necessary to use live models for training, or can one do with just synthetic vessels to develop sufficient manual skills? What do you think
Yeah.
about that?
So honestly, I think like the live models is very beneficial, but the problem is that you might not have access to it 24/7, like compared to the synthetic vessels that you can always have to access to. You can have it in your pocket, you can have it in your backpack, you can prepare it the day before. So having a model that is very accessible to you is a key actually for enhancing your microsurgery.
Thank you.
Yeah, thank you.
And also a quick question for me. So maybe a simple one, but still the important one. You mentioned about the importance of anatomy. Maybe you have some, I don't know, ideal, the best approach to learn anatomy, some tricks or some tools that you used along your career. Thank you.
Yes. Yeah, a very nice question actually. So for every case, like what I do and for preparing for every case, definitely I have to review the anatomy. Like for example, the blood supply, the nearby anatomy, the vital structures I have to be careful of, as well as the basic operative steps. I highly recommend you to actually, whenever you have a procedure, to read a textbook that is more of a basic operative step. There's a book by Kevin Chunk for operative steps in plastic surgery. It's extremely beneficial and it provides a brief, the most important aspects of the anatomy of the procedure. Like, for example, you have a carpal tunnel. The anatomy section of this book, it provides like the main elements and the things you have to know about the anatomy, as well as it provides you like a step-by-step approach for doing a carpal tunnel, starting from the incision and to the closure. So I think the operative books is the best, followed by YouTube videos.
Thank you very much.
Sorry, one more question, if you don't mind. It's more like for comprehends and for understanding, because here in Ukraine, you even being a doctor thinks that you are operating not enough. A small question to you: in how much operations per week you are involved as assistant and as operating surgeon, if it's possible to calculate?
Yes, yes. So basically, like it really varies from week to another. Like some weeks, like we have two free flaps, and some weeks like we have zero. and like the majority of the other cases, like more of a simple cases, maybe like local cases or like more of the simpler form. And the nice thing is actually we get exposed to like all aspects of plastic surgery, the majority of it, and we get like exposure to according to your level. For example, like if you're a BGY5, you'll be like joining in more complex surgeries, and assisting will be less definitely. But however, you'll be seeing more interesting cases and the cases that will be beneficial for your level. Like for example, like someone who's like more a senior level, you don't want to see like simpler cases because you've seen a lot during your earlier year. When it comes to how many days, like I mean, we are in the OR, so it also like depends on the rotations because we have like every 6 months we go to a new hospital. Some hospitals we get a lot of OR exposure, some others like less. So, but I would say like 2 to 3 days. We 2 to 3 days per week is for OR, and the rest usually like between clinics as well as lectures. And when it comes to like the primary surgeon and assisting surgeon, I would say like maybe 40% or 30% of the cases were considered as the primary surgeon, and the rest were assisting. Yes, maybe like the percentage is not fair enough. However, I think like seeing the steps being done by your consultant or like participating in a couple of the steps in the complex procedure, it's very beneficial and it will help you in later on after you become a board certified plastic surgeon.
Thank you. That really a great number comprehends into my own hospital. So, dear colleagues, perhaps someone has more questions to our today's speaker.
Yes, I have. I hope you can hear me clearly now.
Yes, it's better.
Great, great. I'm sorry for this technical issues. It's not first time, so but I have another question, if you will.
Yeah, for sure.
So, do you have any criteria for residents when he trainee and for microvascular anastomosis? When you can say this resident now ready for clinical work at operation room for microvascular case. Do you have any criteria? Do you have any syllabus for this?
Yes. So honestly, because like I'm still a resident, I don't think I have the enough experience to answer your question properly. But according to my current humble experience so far, I think like the more like anastomosis you've done like through synthetic or animal models or even like a cadaveric, this will definitely enhance your experience. And when it comes to the real microsurgery experience, I think it's all about the steps. If you know, like, if you can like first do like cutting the stitches, and then like handling the vessel for your attending, and then like putting the first suture, and then you progress from the first suture until the second, the third, until you do the complete anastomosis. So I think it really depends. I mean, like, it really depends on your performance under the microscope. You cannot say you're ready now 100%, even though I think like even attendings or some attendings or consultants who are like freshly graduate or just became a consultants, they might not be 100% ready. There are always like complexities. There always be like some difficulties in the steps of the surgery itself that makes it difficult or hard. But I think the more you do it, the better you'll be at it. The more you do like anastomosis through synthetic vessels or living models or even animals, non-living animals, I think definitely will make you more confident when it comes to the real experience. Yeah.
Okay, thank you for your answer. Maybe another participants have a question.
Yes,
Okay.
thank you very much for this great lecture about articles. I have a practical question. This summer I visited Hamburg Eppendorf Clinic in vascular surgery, and I'm really interested to write an article about this experience. How how to make or how to I want to contact you us for maybe make collaboration or make an article. It is possible.
Yes, for sure. So basically, what you can like go through my papers and like see the scheme of the paper overall. But what I
Okay.
usually do, yeah, what I usually do like when it comes to like my experience. So first of all, like I try to talk about the institute itself, like about the department, the division, how many number of consultants, what are the variety of cases that they're being exposed to, also like what are the positive aspects that I've learned. Also like when I'm there, I'm trying to like have a small notebook. I just write like the things that I've learned like throughout day by day. Like for example, today like I saw like how to do mapping of the the lymphatic system by using ultrasound. So this is like a very nice thing to learn, like which I learned in ASAN. And then like the next day, I see like for example, ICG lymphography, etc. So you just like think about stuff that you've learned day by day and try to create an article based on it.
Thank you very much.
Yeah. And definitely, I highly recommend you like to read these papers. You can like scan the QR code. You will find my research gate, and then you can check out the articles that I've written previously.
Thank you.
Thank you.
For this comprehensive answer. Thank you.
Thanks.
So, dear colleagues, do you have any question? Please raise your hand or on your mic and ask. So, if anybody don't have a question, I think we can finish our meeting. Again, thank you very much, Dr. Mutada, for your very useful lecture. And I hope in future we can make another lecture
Sure.
with you,
I would love to.
if you will. So thank you.
Yeah, thank you so much for everyone for attending. And if anybody would like to collaborate or have any questions, you can just email me, or you have like my social media accounts throughout this QR code, and feel free to contact me at any time. Thank you so much, everyone, and it was truly an honor.
Thank you. That was a great.
Right, thank you. Bye-bye.
Bye.